Hi, I'm Dr. Rex. I'm an orthopedic surgery resident who hopes to also pursue my board certification in obesity medicine, and I'm going to talk to you today about if you should lose weight before your hip or knee replacement. So it's a common thing for doctors to recommend or ask or require patients to lose weight before their hip or knee replacement. Sometimes this is due to a policy of the surgeon, sometimes it's due to a policy of the hospital or facility that they are operating at. Perhaps most common, it's due to requirements from an insurance company. Often, insurance companies will require patients to have a BMI below 40, sometimes 35, sometimes other cutoffs, in order for that insurance company to pay for a hip or knee replacement. And broadly speaking, I would break down the reasons for why someone might be recommended to lose weight into one of four categories. Number one is to decrease the risk of adverse events after the surgery, most specifically infection. The thing we worry about the most as orthopedic surgeons after a knee replacement or hip replacement is the prosthetic joint getting infected. The next reason might be part of attempting non-operative management before a hip or knee replacement, that losing weight can help improve symptoms of knee or hip arthritis. Another reason that might not be talked about as much, but your surgeon may be thinking about it, would be to make the surgery actually easier. That the less tissue that a surgeon has to cut through, it just makes the surgery easier to retract, visualize the key structures, and actually perform the surgery. Particularly if it's a surgeon that's doing an anterior approach for a hip replacement, having a patient with a lower BMI makes the surgery significantly easier. Lastly, some patients may be recommended weight loss before their surgery to help manage their other comorbidities and risk factors. The most common comorbidity being type 2 diabetes, that it is very important to have good blood sugar control. Different institutions or surgeons have different cutoffs for an A1C. Sometimes they have a cutoff of 8, 7.5, 7 is probably the most common, and losing weight can help patients better control their blood sugar and also help decrease the risk of complications after surgery by having better blood sugar control. So let's actually go through these four things and see how much the research actually supports the practice of weight loss before a hip or knee replacement, and actually if this may be the best thing for you. Disclaimer, as with all my videos, this video is purely for educational and entertainment purposes only. This is not meant for medical advice. I might be a doctor, but I'm not your doctor. You should ask your doctor if you have any medical questions and are wishing for medical advice. So going back through these comorbidities, absolutely. This is something that weight loss can help with tremendously, particularly diabetes. It is well established that the risk of complications, particularly infection and wound complications, does increase as a patient's blood sugar increases and their A1C increases. And it's very well established that weight loss can help. If you are trying to better control your blood sugar to help decrease your risk of complications before a hip or knee replacement, I think it's totally a great idea to work on weight loss as part of strategies to optimize yourself before surgery. Now, should you lose weight to help your surgeon out? That's between you and your surgeon and a discussion with them. Perhaps they're a surgeon that does have a BMI cutoff of what they know they can do a certain approach safely for your joint replacement surgery. And so that is a personal discussion between you and your surgeon to make sure they are doing your surgery as safely, effectively, and efficiently as possible. Now, as far as non-operative management, does weight loss actually work for some patients? I can say that yes, absolutely. For some patients, weight loss can be a huge factor in improving their quality of life and decreasing the pain they experience. The classic number you'll see thrown around is that every pound of weight you lose is about 4 pounds less pressure on your knees when you're walking. And so when you are losing weight, there is less pressure on the arthritic bone and on the cartilage wear and potentially on the bone-on-bone arthritis, and that can help your pain tremendously. Of course, if you have truly terrible arthritis that is bone-on-bone, greatly limited range of motion, weight loss maybe is not going to help with your symptoms. But if you are in an early stage of the disease and you're just getting some knee pain, starting to notice your joints are aching, I think starting with some weight loss and working on just in general a healthy lifestyle, healthy exercise, healthy diet, and weight loss that may come from that is absolutely a wonderful thing for your health and a good way to take ownership of your own joint health. So now the most interesting one to talk about is, does weight loss before a knee replacement or hip replacement actually reduce the risk of the complications we worry about that do increase in prevalence as a patient's BMI increases. So it is well established that patients who have a higher BMI do have an increased risk of complications. And so it's not coming out of nowhere that insurance companies, doctors, different hospitals have policies to recommend patients above a certain BMI not go forward with surgery. That is supported with the literature. There's not something magical that happens when your BMI goes from 39 to 40 to 41, but there is a steady increase in risk of these complications we worry so much about, infection, revision rates, as the patient's BMI increases. Now, the interesting thing is that there is no current evidence that supports a patient who has a BMI above 40 losing weight, having their BMI come below 40, and having that actually be shown to decrease the risks of complications. And this is something that I've actually personally studied, I've published in the literature on. And if you actually look at the data more, even if you only look at patients with a BMI above 40 and they drop below 40, there's no change in the risk of their outcomes that we've been able to find. But if you have patients that are actually just a little bit overweight and they start losing weight, this is retrospective, just looking at it, you don't know why they lost weight, those patients actually start having greatly increased risk of complications. And so that data, of course, is not perfect. It's retrospective. Nobody has studied this with 1,000 patients, asking them to do a diet, tracking their weight beforehand. And so these patients losing weight, they might be losing weight for other reasons, unintentional reasons, due to other medical problems that are putting them at greatly increased risk of complications. And so I'm not saying in any way that weight loss is ever going to be increasing your risk of complications. I'm just saying that there's no data to support that losing weight will decrease your risk of complications in the studies that have been done so far. And there is some evidence to support that patients who have lost weight, perhaps it's because they have some undiagnosed disease causing them to lose weight, they are losing weight in an unsafe manner and developing nutritional deficiencies. We don't know, this is retrospective data. There are some cases where patients losing weight before a surgery are actually increasing their risk of complications. And one subset of weight loss that has been well studied is bariatric surgery, that patients who have a history of bariatric surgery, even if they lose a lot of weight, even if you compare them to patients who had a similar starting BMI and didn't lose weight, patients who have a history of bariatric surgery are always at an increased, not a decreased, an increased risk of complications, particularly infection and revision. And the thought is that when you undergo bariatric surgery, you always do have some change in your absorption of micronutrients, and you may be in some way malnourished, even with the best supplementation and the best, taking of all of your vitamins that you need to take if you have a history of bariatric surgery. Despite that, those patients may have some factor in their nutrition that is increasing their risk of complications. Now, I want to add in GLP-1 agonists and how this potentially impacts this weight loss that people can have before a hip or knee replacement. GLP-1 agonists are incredibly effective compared to any other interventions that medicine has developed for weight loss. This is your Wegovy, Ozempic, Mounjaro, Zepbound. These drugs have been shown to help people, many people, not everyone, many people lose a very significant amount of weight. And it is not yet known if weight loss with a GLP-1 agonist is better or worse, the same as weight loss without the assistance of these drugs, as far as impacting your risk of complications after a knee replacement or hip replacement. So I don't have anything that is definitive. I will say this is just sort of anecdotal experience that many patients who take these drugs do notice that it is easier for them to avoid proteins, that proteins sometimes makes people feel more nauseous, and they sort of stick to diets of more simple carbohydrates. That's the only thing that tastes good or feels good, feels like something that they actually want to eat while they're on these drugs. And one of my concerns about weight loss in general before a hip or knee replacement is that if patients are not getting enough protein to actually heal their body, are developing other deficiencies from not eating a balanced diet. And so I think the important thing is to make sure that you are still eating a balanced, healthy diet. Whether you are trying to lose weight or not lose weight before a hip or knee replacement, probably the most important thing is that you are still eating a balanced diet, having adequate intake of protein, most importantly, prioritizing protein. Secondarily, making sure you're getting all of the micronutrients your body needs to actually heal from this surgery so that you're not developing deficiencies that could lead to wound complications and your immune system not being able to fight off an infection and preventing an infection from actually happening. So final thoughts about should you lose weight before your hip or knee replacement? I think that is a decision that is up to you. I think in general, weight loss, trying to have it the healthiest weight possible is a good thing. Trying to maintain exercise, maintain a healthy, well-balanced diet is great and something that everyone should be striving for, regardless of if there's someone with osteoarthritis, other types of arthritis, whether they are preparing for a surgery or not. That being said, I don't think patients should feel tremendous pressure that they need to lose weight, they need to crash diet, develop nutritional deficiencies just to fix some number on the scale because they were told that they're going to get an infection if they don't lose the weight. That's not supported by the data. The most important thing is having some balance in your life, working on your health, controlling what you can control, having the best diet that is making sure you're meeting all your nutritional needs. If you are losing weight in the process, getting some benefit from that, that is outstanding. But I don't know if it should be a requirement. If you have any thoughts or comments about this, I'd love to hear them in the comments down below. Questions, I'll try to answer them. If you have ideas for future videos or future topics you'd like me to discuss, I'd also love to hear those. If you want to catch those videos, make sure you subscribe to stay notified. As always, like the video if you like the video, dislike the video if you dislike the video. And until next time, don't be ordinary, go be great.